Hello, I'm Kevin Bechard, and this is A Healing Landscape Indoors. The concept is to develop a time-sensitive, interactive indoor garden for hospitalized people and stay-at-home residents to help increase mental well-being. These timeline goals help situate the project as a starting point and help develop the product, also showing how I will be moving through the presentation today. First, I will be starting with memory and looking at the user needs, where we can create the most impact. Then moving into the landscape and research, and then focus on the overall goal. Gardens and healthcare facilities are not new things, but I wanted to cover these things to give you an idea if you aren't familiar. The Therapeutic Landscape Network's definition of a healing landscape is any landscape, designed or wild, that facilitates human health and well-being. This definition really provides the idea that this could be any landscape. But what if this was catered to a certain landscape and time, to pinpoint the exact time for a certain user's health? This could be challenging for a lot of different reasons, but most of all, because that certain plants are no longer living with us. I see nature playing a big role in health. When plants and species are becoming extinct, how can we relate back to these landscapes? How can we relate back to sounds and architectural forms of nature? Developing nature landscapes for aging populations can help fixate the user into an era and help spark important memories. But a time machine we don't have. In California, there's a place called Town Square. Town Square is an adult daycare franchising model focused on older adults with dementia and Alzheimer's. The users visit for a day and reminisce in those eras. As Amy previously mentioned in the last presentation, reminiscence therapy is a powerful tool. But what if instead of a building, this was a natural landscape? The users could be placed in a garden or an environment that was like theirs of their youth. According to a study by life insurance company M.LA, today there is more than 5,000 adult day care centers serving more than 260,000 participants and families, caregivers across the United States. These facilities are growing and allowing seniors to age in place while saving health care system thousands of dollars by decreasing hospital admissions. What if we could decrease this even further? The idea of biophilia and reminiscence therapy is not new. We know these two things have great impact, and there's plenty of research showing how both things are proved to work well. But what if we took these two ideas and combined them into one? What if we were to create a time-sensitive, interactive indoor garden for hospitalized people and stay-at-home residents to help increase mental well-being? Sound familiar? These artificial landscapes like town square facilities can be easily designed with the planting plan created. The landscapes will resemble those different eras and can be easily switched out for different eras and allow for sounds to be piped in to get the overall feeling. This picture shows an unusual amount of hedges, mainly to the plant privet or euonymus. Most of them were installed in the early days before fences were allowed. With artificial landscapes, we won't have to worry about these places becoming extinct. This is a mock-up in the hospital for the patients and visitors of the area. Including the landscape plan, there will be an app. As of 4/19/2020, the stay-at-home order is in place here in Michigan. This project is relevant in these times for those feeling trapped and would work great in a pandemic situation. The app would have a drop-down menu with a list of species from the 1920s to 2010. These species would be listed with nature sounds surrounding the user's past climate. These plants would be delivered and would be installed around the room. The website or app would provide a personal garden assistant from that era to help you install your artificial generational garden and virtual one as well. The app would also allow for a VR mode to digitally select your plants and incorporate them into your home. Either virtually or physically, this immersive landscape design would allow users to have the feeling of being transported to the era of their choosing. This process will not only help situate the user into the era they remember the most and most comfortable with, but it will also allow for a unique trip down memory lane with loved ones, maybe hearing stories they have not heard before, and learn from one another. It will also have an intergenerational experience with younger generations to learn about landscapes that once were and can never exist again. The design outcome is a healing garden with artificial plants, virtual or artificial, to relate back to the past landscapes. and the outcome is improving life satisfaction, quality of life, and depressive symptoms in older adult populations, while teaching younger populations about a landscape that once existed. Thank you for your time today, and I hope you can travel into the past with me.